Welcome back to another MedRevisions video. Today we'll discuss an October 2020 recall and also give you some tips for the PLAB Part 1 exam. Alright, let's dive right into the video. Now before we discuss the question, please take 50 seconds to answer the question. Then pause the video and comment the answer below. See if you got it right. Okay? Now, you should know that all the answer options that are given in this are high-yield topics for PLAB 1. And we have covered it extensively throughout our MedRevisions platform with different styles of questions to make sure that you understand these topics very clearly for the PLAB Part 1 exam and that you are able to tackle any type of question that is thrown at you in the exam. Okay, and also, check out our reviews. Check out the reviews from our past PLAB candidates. The link is in the description below. Take a second and smash that like button like you would during CPR. And also comment down below on what other topics you'd like us to cover in the future. Let's get to the question. So we have a mother who takes her 4-year-old boy to the pediatric emergency department. He's got a fever and she found raised nodes on his neck. She gave him paracetamol and ibuprofen, but there is no drop in his temperature. Lips are dry, extremely dry, cracked. Tongue is red and swollen slightly. She's noticed that his feet are now red and puffy as well. He's developing a widespread fine rash. What is the single most likely diagnosis? Alright, the correct answer here is Kawasaki disease. Okay, make sure you know Kawasaki disease well because it is a very commonly asked question in pediatrics. So, Kawasaki, scarlet fever, parvovirus and measles, and hand, foot and mouth disease. Okay, so let's talk about scarlet fever. Now, do not get Kawasaki disease and scarlet fever mixed up because there may be some similarities with regards to their presentation. So scarlet fever also presents with an inflamed tongue, but that wouldn't explain the red and puffy feet, which would later discriminate. And the primary complaint of scarlet fever is usually sore throat. Alright. Now what about parvovirus? Parvovirus B19 is also known as slapstick syndrome, and there are no indications pointing towards that diagnosis. Now measles presents with a fever and coryzal symptoms, okay? And the Koplik spots that are seen on the oral or buccal mucosa. Koplik spots, remember this is important. These are bright red with bluish white specks at the center, and then a maculopapular rash will come about in 3 to 5 days later. And what about hand, foot and mouth disease? Hand, foot and mouth disease is caused by Kawasaki virus. Starts with a general malaise and pyrexia, and but the skin lesions are in the form of vesicles that appear in the mouth, okay? And 75% will develop an eruption on the hands and feet with tender papules and vesicles, hence the name hand, foot and mouth disease. So Kawasaki is the correct answer because this presentation is typical of that. It presents with high fever that is not very responsive to paracetamol or ibuprofen, okay? So this is a clincher. A high fever that is not very responsive to paracetamol or ibuprofen is pointing us towards Kawasaki. And also the strawberry tongue, the dry cracked lips and the inflamed mucosa. All of this, plus the erythema and edema on the extremities, which will be followed by disquamation of the disquamation. All of these points us towards Kawasaki disease. Okay, I hope all of you got it right. If not most of you, and if you did not get it right, that is okay. You can learn and amend your mistakes. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.